Hello, everyone, and welcome to Live at 5. I'm your host, Anita Vogel. Some of you may know me from the Fox News Channel and various other media outlets I've worked for across the country. Thank you so much for joining us tonight. We have such an important and interesting program planned for you. Tonight, we are talking about ACEs. Have you ever heard of that? Adverse Childhood Experiences, ACEs. These are toxic situations that children go through that end up actually affecting their health later in life. Huge health problems, things like heart disease, stroke, even cancer. These can all develop from ACEs, adverse childhood experiences. Now, later in the program, we're going to be talking to the California Surgeon General. Her name is Dr. Nadine Burke Harris. A few years ago, working at Fox News, I had the opportunity to interview Dr. Burke Harris, and we did a big story on ACEs. In fact, she gave me her book. It's called The Deepest Well, Healing the Effects of Long-Term Childhood Adversity. You may think that sounds like a dry topic. I did before I read the book, but she had me at hello. Literally, from the first word of this book, I could not put it down. It was so interesting. It was filled with real life examples of how these toxic situations affect children and what happens to them later in life. Now, we have an amazing panel of experts who are going to be joining us tonight to talk about the importance of identifying these ACEs and helping kids so that they can grow up to be healthy adults. But first, we have a special guest, and I also want to mention real quick, no matter where you're watching our show tonight, on Facebook, on YouTube, you can write in and ask a question. Just write in on the chat, and the producers will let me know, and we're going to get your questions in. Now, I want to bring in a special guest we have tonight. We have Dr. Puja Mittal. She is the Medical Director for Population Health Equity for HealthNet. Doctor, what a pleasure to have you here tonight. Thank you so much for joining us. Tell us a little bit about yourself. Take about 2 minutes.
Sure. Thanks so much for the introduction. I really appreciate it. My name is Puja Mittal. I'm a medical director for population health equity here at HealthNet and also a family doctor. And we are really honored to be partnering with the California Health Alliance for Children and Family Services, as well as the Catalyst Foundation for tonight's event, because it's about ACEs, which is really especially timely in the setting of Mental Health Awareness Month. And as a plan, we're really focused on providing wraparound support where kids need it at home, in schools, and in doctors' offices, which is why we really invest in preventative programs and then screening for adverse childhood experiences. We are super excited that tonight's event is focusing on the California Surgeon General's statewide effort to cut ACEs and toxic stress in half in one generation. And as a plan, we do a lot to support this work to try and help meet that bold goal. And I'd really encourage you to check out numberstory.org. It's part of Dr. Burke Harris's campaign on learning about your ACEs and starting to be able to tell your own number story about ACEs. We are really excited and grateful that you are here today, and we hope that you enjoy tonight's event. Thank you.
Thank you so much, Dr. Mittal. Thank you for joining us, and we're going to check out the numbers program that you mentioned and all good information. Thank you. All right. Now we want to get to our distinguished and expert panel to talk more about this subject. So first, we want to welcome in Chrstine Stoner-Mertz. Hi, Chris.
Hi, Anita. How are you?
Good, good. Thanks so much for joining us. So important to talk about this, especially during these troubled times we live in. So I'd love you to just introduce yourself to our audience. Tell them what you do, where you're from, and why you're here.
Thanks. My name is Chrstine Stoner-Mertz. I'm the CEO of the California Alliance and our Catalyst Center. We are here tonight talking with all of you about how important it is that we address adverse childhood experiences early so that we have healthier adults in the long run. We are a 150-member organization that our members are serving children and youth and their families throughout California, all nonprofit organizations in communities. And we're providing advocacy and policy work at the state level to ensure that children and youth have access and that their families are able to get their needs met as quickly as they can. So we're very excited to be here tonight and thrilled to have HealthNet supporting this effort. So thank you so much.
Yeah, it's wonderful. Well, thank you, Chris. Next, we want to bring in Cornelle Jenkins. Hello, Cornelle.
Hi, Anita. How's it going?
It's going great. Thanks for joining us tonight. So, same drill as Chris. Tell us who you are, what you do, and why this is such an important topic.
We'll do. First, thank you for having us on. My name is Cornelle Jenkins. I am the Director of Strategic Initiatives for the Catalyst Center. So we have the California Alliance, which is our advocacy and policy side, and the Catalyst Center is our technical assistance and training arm. So all of the work that we do at the Alliance and we provide to our members and work with legislators there, we want to have a broader impact and help all throughout California, members and non-members, be better fit to help children and families. Today, we're talking about ACES in particular, and that's one of the grants that we have at the Catalyst Center, which we'll talk about a little bit later. And so it's a very important topic, talking about how experiences from your childhood can affect not only your physical health, not only your mental health, but your physical health as you grow into your adult life. And there are ways to combat that, and we're excited to kind of dig into a little bit of that today.
Yeah, it is really astonishing. As I was talking about when I read this book by Dr. Nadine Burke Harris, and I had the chance to interview her for Fox News, I had never heard of this before, but it makes perfect sense, right? If you're a child and you experience, and there's a list of 10 things, we're going to go over them later, but things like divorce, things like abuse, and the list goes on, you know, it kind of makes sense that you would be suffering from health problems later in life. So, Chris, tell me, how did your organization become aware of this program, and what are you doing about it?
Thanks so much, Anita. You know, our members have been serving children, youth, and families for decades, some of them even more than decades. And so it's natural that they learned about the Kaiser study that and the engagement around that Nadine Burke Harris has made even before she was the Surgeon General, when she was running her own nonprofit, right? Mm-hmm. And was getting the word out about how important it is to address these issues early. So our member organizations are seeing and doing that on a day-to-day basis. And they're working with foster youth, they're working in the mental health community, they're working with families that suffer from substance use. So all the way from prevention services to very intensive services for children who may be suicidal, may be showing up at emergency departments, really needing urgent care. So they're doing all kinds of work across the state to address and hopefully get in there as early as possible to help these kids and their families.
Mm-hmm. So you mentioned, you know, Dr. Burke Harris was doing this work even before she became California Surgeon General. She had opened a clinic in a very challenged neighborhood of San Francisco. And in treating children, she sort of stumbled upon this idea that these kids that were having health problems all suffered from some form of toxic stress early in their life. And then she discovered the study that had been done by Kaiser Permanente and the CDC, and she put all the puzzle pieces together. And so now she's really working to get the word out about ACEs. So what is your organization doing, Cornelle, to try to make doctors aware of this screening process, the ACEs survey, so that they can detect this in the kids that they see?
So there's multiple fronts that we're attacking this on. We have 3 grants from the Office of the Surgeon General under the ACEs Aware Initiative. One of those grants is to provide a supplemental training. So there's the core training, which teaches about the screening process itself. the supplemental training, which we provide, goes to the next level. Our supplemental training was focused on quote unquote special populations in their intersection with ACEs. So we're talking about communities of color, refugees and immigrants, C-sex youth, commercially sexually exploited children. And so special populations. So we're talking about how ACEs intersect there. Also, we talk about the cross-sector collaboration. So doctors' offices are usually sending referrals to other doctors to get an x-ray, maybe to some mental health services, but there's a lot of buffering resources that we'll also get into that can combat ACEs that doctors don't necessarily have the connection to. So our training teaches them how to build those relationships and how to actually work with people outside of their sector. We have a communications grant, which is we're providing blogs and different information through our various social media sites about ACEs and about other ACEs training. And lastly, we are working with ARERA, who is kind of leading these efforts to create regional meetings to get these sectors, like I said before, cross-sector collaboration, to get these different sectors talking to each other, figure out, okay, how can we best serve our communities? And so, those are the main three ways that we are working with ACEs.
So lots of different things going on. Chrstine, you mentioned, actually you didn't mention, but I wanted to ask you about the numbers program that Dr. Mittal mentioned before. I want you to talk about that, but I also want to know how has COVID-19 affected your outreach on ACEs awareness?
Well, just to answer the question about the number story, I mean, this is, from my point of view, a real outgrowth of what the Surgeon General has been working on. And now we're getting, it's getting national attention, which is just extraordinary because this effort, the number story, really offers folks the opportunity to learn about ACEs, learn about their own ACEs, essentially do a self-screening to identify if these issues, have impacted them in their lives. So it's making it accessible to the layperson, right? Often people think of identifying these issues as requiring professional help, but you can do a screening and begin to understand how some of these things might be impacting you even as an adult. So that's the number story. And along with that, the initiative that the Surgeon General has done in California is just having an extraordinary impact, I think. Her goal of having, at least 50% of providers able to do screenings was a lofty goal, but we're moving closer to that goalpost every day. So yeah, in terms of how children are being impacted by COVID, there's just no question that that we had a mental health crisis for kids prior to the pandemic. We knew that not all children, particularly children in communities of color, low-income youth, were not getting their needs met in terms of their mental health. The pandemic has really shown a light on that, frankly. Mental Health America did a survey in September of 2020 and found that about 50% of 11 to 17-year-olds were saying that they had thought about suicide in the last 30 days.
Wow.
There's just statistic after statistic that shows this is having a negative impact on kids. The issues of social isolation, not being able to go to school, feeling disconnected from really every potential resource that they might get through their school or through their network, it has been cut off. And then for youth and communities of color and low-income folks, those are the families that are essential workers. They are the families that are often the first to lose their jobs. They also tend to be living in housing that's very dense. And so they are, as we know from all the reporting that's been done on COVID, those families are also the families that are being hit the hardest by the virus. So you just add on all these issues that children and their families are facing. Lack of broadband access. So they're not, some of them are doing school on their parents' phones. They're just one thing after another has just really shown a light on what a crisis this is, and we're heartened by the state's response, though, and I know we're going to talk a little bit about that too.
Yeah, absolutely. So if anything, just to wrap up, it seems like maybe COVID-19 has highlighted the need for ACES, for the questionnaire. For, you said 50% of doctors' offices are now using the questionnaire.
I think we're on our way. I'm not exactly sure what the number is yet.
Okay. But. Well, yeah. So the problems associated with COVID-19 have really brought forth the need to do this kind of questionnaire for kids. All right. Well, thank you so much, Chris and Cornelle. And I think we're going to talk to you a little bit later in the program. Right now, we want to take just a few minutes to hear from Dr. Nadine Burke Harris, the California Surgeon General. We've been talking a lot about her because she is the one who's really pushing this ACES Aware program throughout the state. So here is a little something from Dr. Burke Harris, who unfortunately couldn't join us today.
Hi, I'm Dr. Nadine Burke Harris, California Surgeon General. We often think of mental health as an individual issue. However, it's becoming increasingly clear that it is time for us to take a public health approach when addressing mental health. That means engaging in prevention by identifying and addressing modifiable risk factors for mental health disorders, such as adverse childhood experiences, or ACEs. That also means supporting early detection and evidence-based treatment by integrating primary care and mental and behavioral health, and ensuring that everyone has access to high-quality, evidence-based care. It also means investing in the community conditions that support mental health and well-being. Mental health is health, and collectively, we must come together to support community-wide health and well-being. A fundamental part of any public health approach is raising public awareness. That's why I'm so pleased to share with you 2 new initiatives that it's been my honor to partner with. Numberstory.org is the first ever national public education campaign on ACEs, and it helps the public understand about what are adverse childhood experiences, how do they affect me, and connect to helpful resources. And the Me You Can't See is a groundbreaking series featuring Oprah Winfrey and Prince Harry, hosting courageous conversations on mental health, which launches on Apple TV this Friday, May 21st. These are 2 of many new initiatives that will help to take us one step closer to the world that we all want to see. A world that you all are working very hard to make a reality. And while I'm not able to be with you all today, know that I am so thankful for your passion and dedication and for the vital work that you do every day. I look forward to celebrating your successes in person sometime soon. Thank you so much.
Well, that was great to hear from Dr. Nadine Burke Harris. You know, when I did my interview with her for Fox News, we flew up to San Francisco, we drove to her clinic, and we were shooting some video outside. And unfortunately, we got robbed right then and there. Our camera got stolen and I lost my amazing interview with her. So I was still able to put the story together, but I hope to maybe interview her again one day. So maybe right here with our panel, we can do it another time. Okay, so I think next we were hoping to have State Senator Anthony Portantino with us, but I think he's having a little, is that him? Is that you, Senator?
Yes, I'm here.
Oh, you made it. I know you were having a little trouble logging in. I'm so glad you could join us.
I'm here.
You're here. Very good. Well, welcome to the program, State Senator Anthony Portantino. Senator, as you know, we're talking about the ACES Aware program. Wanted to know what draws you to be an advocate within the California State Legislature for mental health issues?
Well, thank you, Anita. It's great to be here, and it's such an important topic that we're covering today.
It is.
For me, it's personal. A decade ago, my older brother took his own life, and suddenly I became a member of that club that no family should have a family member in, a survivors club. And what struck me after my brother's suicide was just how many friends and neighbors had a family member struggling with depression and mental health who never shared their personal story until I became a member of the club. And then I became a safe person to confide in. And so it really struck me. There's how many people have a mental health issue in their family. And that's when I started to be a strong advocate and started to pursue policies to help bring mental health out of the shadows, like putting the suicide prevention hotline number on all student ID cards, which stimulated not just a place for students to go for help, but a conversation around why that student ID card has the helpline versus the football schedule. And so that's what brought me to be an advocate.
Well, thank you for sharing your personal story with us. And it's true. So many families have family members with mental health related issues, and there's still such a stigma attached to it. Nobody wants to talk about it. And yet so many of us are dealing with it. Right. So have you seen any change within the legislature in terms of members being more accepting that these issues are so prevalent?
Oh, absolutely. There's now a mental health caucus, which is bipartisan and bicameral. There's lots of focus on mental health issues. And, truthfully, you hit the nail on the head. People will go to a party and they'll talk about their cholesterol. They'll talk about their waistline. They'll talk about their son or daughter's sprained ankle and the sports injury. But they're not going to talk about, unfortunately, many of them won't talk about somebody dealing with depression, bipolar, anxiety. And so those are the issues that I focus on. This year, I've got a bill to, as Dr. Burke Harris said, mental health is health. And I have a bill to treat mental health the same as physical health. Because right now there's a flaw in ed code where an absence if you're home with depression isn't necessarily approved, where if you have a cold, it's an approved absence. And so what struck me is I was on an editorial board and one of the editors said, well, what happens if a parent lies about their kid struggling with depression as an excuse to be home? I said, well, you don't ask that parent if they lied about the cold. Why would you think they would lie about depression or anxiety? And I said to the editor, the fact that you asked that question is why we need the bill.
Yeah, isn't that interesting? And it's, Dr. Nadine Burke Harris, in bringing the CDC study, the CDC and the Kaiser Permanente study to light, she really shows the connection between mental health issues and physical health issues. They are connected. There is no doubt about that. What other elements have you been able to craft together in any sort of package of legislation?
Yeah, this year we want 50% of all school personnel to be trained in some form of mental health first aid. We train, people in CPR. We want them to understand the suicide precursors, other mental health issues. When I presented the bill earlier in the year, a dad called in and said, my 14-year-old daughter handed in her journal as an English assignment and got an A on the journal, and then a couple of weeks later took her own life. And he was not angry at the teacher for not seeing the signs of suicide. He said the teacher wasn't trained to understand and know what she was reading. And he said, that's why we need to train school personnel to recognize these warning signs. The bill also seeks to have peers take the same sort of mental health first aid class because, peer-to-peer relationships are important. So that's one bill. That's SB 14. Mm-hmm. And then we also have SB 224, which will create a curriculum for students to learn about mental health in elementary school, middle school, and high school. We know that peer-to-peer relationships are very important. I always tease that my own daughter bought a particular car because the barista suggested the car to her, not her father or her mother. She took the advice of a fellow teenager on which car peer-to-peer relationships are important. So we want young people to learn about mental health through their academic careers through K-12 so they can be good advocates for themselves and good advocates for their peers. And so we've got those two bills working through the process. There's a lot of focus and a lot of support behind them and a lot of need.
Yeah, that's wonderful. And I think you've hit good timing because in these COVID times, we're hearing so much about depression and unfortunately suicide,
Right.
just from isolation, but it really helps to bring the whole issue to light.
Absolutely.
Did you find that because of these times, this has been an easier subject to talk about?
Well, it's an easier subject to talk about with a lot of people, but still, you have to advocate. You have to get out there and put the personal stories. One story I share is a mom told me about her 13-year-old daughter who was really, really anxious to go back to in-person learning after 14 months because she had developed acne. And, normally that's a gradual transition, but here she was all of a sudden had acne and she didn't know what to do. And she was afraid to go to school and she was anxious and she was nervous. The heartwarming part is she came home with a big smile on her face and the mother said, "What happened? You were depressed this morning." And the daughter said, "All my friends had acne." And so she was not alone. So, little things mean a lot to our teens, and this return to in-person learning when they've had such a distance from their peers and their relationships. And, my mother used to say kids have forgotten how to play.
Yeah.
And, it's true that, on the best of circumstances, the more plugged in they are, the less they play. And now with 14 months of being home, many of them have lost the ability to have just simple conversations without anxiety and depression. And so we really have to get ahead of all these issues.
Yeah, that's for sure. Kids need to be back in school 100%. Parents will be happy about that too.
Yeah.
Well, thank you so much. We really appreciate you joining us today. And good luck to Senate Bill 14 and Senate Bill 224. We'll be keeping an eye on both of those.
Thanks, Anita. Be well yourself. Take care.
Thank you so much.
Bye-bye.
Okay, so in talking about ACEs, adverse childhood experiences, what are they? That's an acronym, but people probably want to know what they are. Well, it turns out, and I think we have some graphics to share with you, there are 3 types of ACEs: abuse, neglect, and household dysfunction. And they cover a lot of different areas, but they all fall under these topics, these 3 topics. Now, what Dr. Nadine Burke Harris is pushing is for physicians across the state to introduce a screening guideline to patients, to young patients. It's a questionnaire that they would give to patients to see what sort of problems are they having in their young life. Our next graphic will show you the topics that they're asking. These are the 10 questions that are on the ACES questionnaire. Have you had emotional abuse, physical abuse, sexual abuse, physical neglect, emotional neglect, substance abuse in your household by any member of the household, mental illness in the household, a parent, a sibling, a cousin? Was your mother treated violently? That can really get into your psyche. Are you the child of divorce or parental separation? Was there criminal behavior in the household, and did a member of the family end up in jail? You'd be surprised how these topics, how these experiences, these toxic experiences affect a child. And in the book, Dr. Nadine Burke Harris goes through how these questions, they keep score. So if you have 3 of these, if you've experienced 3 of these or 4 of these, your chances of developing serious health problems later in life rise. And she really connects these problems to physical changes in a child's brain that can prompt health problems later in life. So really important to get this screening into doctors' offices across the state. Now, our next guest, we also want to bring in someone from the California legislature. Next, we have State Assemblyman James Ramos. Assemblyman, are you with us?
How you doing?
Hey, good. There you are. Thank you for joining us today.
Thank you. Thank you so much for inviting me.
Yes, of course. So I don't know if you were able to listen to our discussion with Senator Portantino, but we were talking about important changes that are happening in the legislature, members being more willing to talk about the subject of mental health. So I wanted to get your take on that. Are you finding the same experience?
Certainly, with our bill, AB 2112 last session that was signed into law by Governor Newsom, for the first time set the Office of Suicide Prevention in the state of California. And we found that colleagues were more open to discuss interactions with those with mental health issues around them. Particularly when we went to the Senate floor, there was Senate members that were talking about they knew someone or have experienced something with mental health, and in particular within the suicide prevention model. So we're starting to break that stigma of being able to openly talk about the mental health issues that are affecting so many of us here in the state of California at all ages.
You know, Senator Portantino shared with us a very personal story that what has drawn him to talk about and advocate for mental illness, help for mental illness, is that he had a family member that took his own life. So let me put that question to you. What draws you to this topic, and what makes you want to be an advocate for change?
So within the Native American community, suicide has always been a high statistical outcome of many Native American people. And those that we know, close personal relations to us, have either attempted or have thought about suicide. But yet, when they think about that, we have a 1-800 number, but yet we need to be able to talk to people, right? People to understand what people are going through. So knowing that and growing up on the Indian reservation, ultimately becoming county supervisor of San Bernardino County, we've seen how at a young age, a sixth grader in one of the areas that we represent committed suicide due to peer pressure, social bullying. If we're not able to address and openly discuss how mental health, and in particularly suicide prevention, is something we need to continue to open up and talk about, our young people, as young as in sixth grade, are committing suicide. They're asking for help. But yet, as adults, whenever we bring up mental health or suicide, some people shy away from even discussing that topic. Here in the state legislature, we're seeing more of an openness to discuss it and to make it one of the top priorities of moving forward. I've said over and over that we cannot talk about moving our economy forward unless we're able to talk about the mental health component of moving the economy forward, meaning that those are suffering from mental health have resources that are available to them.
Yeah, so important to let people know that there's help out there. Sometimes it's hard for them to seek help. Sometimes people who are the most troubled have the hardest time seeking help. Talk to me about some of your other priorities within the legislature this year to help move the ball forward.
So certainly within part of our request within the funding component is to fully fund the Office of Suicide Prevention in the state of California. And we were glad to see that in the May revise that the governor has put back to the legislature that there is ongoing funding to continue to work within the Office of Suicide Prevention. We do have other bills that we're looking at. One in particular deals with our youth again. We've been able to look at and work with adult crisis stabilization units, but we have to be able to be open to working with our children to make sure they have crisis residential programs for our youth. Because if we're expecting our youth to just get back into school and pick up where they left off, then we're fooling ourselves, because I know some people that have succumbed to COVID-19. So we know that our youth also know some people that have succumbed to COVID-19. So we have to make sure that those resources are available for our youth. And that's AB 226 deals with children's crisis residential programs. We also have a suicide lifeline, a lifeline that we're working in conjunction with another legislature to ensure that a 988 suicide lifeline system is put into place. Because many times when someone's suffering a mental health issue in an area that's in our community, sometimes the first number they call is 911 that sends the fire department, local law enforcement. That might be too much for someone that's already suffering from a mental health episode to be able to comprehend what's going on. This would set a 988, a suicide lifeline system, to get the resources to the individual that needs those resources in real time. Another bill, AB 681, deals with involuntary confinements and data collection. These are issues that we want to continue to work on. These are issues that we need to get resources and build that infrastructure for those that are going through mental health episodes, that their end result wouldn't be a trip to county jail or to the emergency room. We owe it for long-term crisis residential treatment, 90 days plus treatment for those for mental health that we need to get back in the infrastructure within all throughout the state of California. This would start to address those issues that we're talking about with mental health illnesses and mental health issues in particular.
Yeah, you bring up a number of great points. Really, you do. And we're going to be watching your bills. You mentioned AB 212 and AB 226, right?
AB 226 and
AB 212?
And AB 212.
Is that it?
AB 270 and AB 681.
Okay. Wow, you're a busy guy. You got a lot of stuff going on, yeah?
Our hope is that one day we'll be able to have an area where all the mental resources will be able to have a one-stop area to be able to get the full resources you need. Right now, if someone is suffering from a mental health issue, if it's dealing with suicide, we need to make sure those resources are there. If they're having a mental health episode, then we need to make sure that there's crisis stabilization units that are there. We want to make sure that there's actually a catch-all for all these resources, so it becomes a one phone call, a one resource that gets out to those that are suffering in an episode of mental illness.
Yeah, that would be a great idea. Terrific. All right, Assemblyman Ramos, thank you so much for joining us today and providing all that great information. And we wish you the best of luck with your bills, and we'll be keeping a watch on them. Thank you so much.
Thank you so much.
Of course. Okay, I think we're getting a lot of interesting questions from our audience, and I think we're going to take those questions in just a moment. But I believe we are going to bring in now our ACES panel. Is that right? So I think we have Jen Leland, Danielle Prince, and Stacy Shwartz. Olagundoye, is that correct, Stacy? We did it in the preview. Did I pull it off?
Beautiful. Thanks, Anita.
Okay. All right. Wonderful. All right, ladies, thank you so much for joining us. Let's dive right in, but let me have you first introduce yourselves to our audience. Tell us who you are, what group you're with, and what brings you to our discussion today. And Jen, let's start with you.
Sure. Good evening. What a great panelist group to be with. So my name is Jen Leland, she, her pronouns, and I am the Director of Partnerships for Trauma Transformed in the East Bay Agency for Children out here in Alameda County. And we're honored to be a part of the statewide ACES Aware Initiative. And we have 3 current activities that are being funded and promoted and invested in throughout the state of California through the ACES Aware Initiative.
Okay, wonderful. Okay, Danielle Prince. Danielle, I think we've got you now. Welcome to the program.
Thank you. Hi, I'm Danielle Prince with ACES Connection. ACES Connection is a social network that helps support communities that are building resilience initiatives to help address ACEs in their local communities, and we provide technical assistance to the ACES Aware Initiative.
Okay, wonderful. Okay, and Stacy Shwartz Olagundoye. Love that name. Stacy, thanks so much for joining us. Tell us who you are and what brings you to the program today.
Thank you, Anita, and hi, Jen and Danielle. Great to see you both again. I'm Stacy Shwartz Olagundoye, Program Manager at the Catalyst Center. I work with Cornelle Jenkins and Chrstine Stoner-Mertz. And we are also an ACES Aware grantee. And as Chris and Cornelle described at the top of the hour, we're busily tidying up our 3 grant areas and are very excited to provide services across the state.
Wonderful. And it sounds like you three ladies are really carrying out the mission of Dr. Nadine Burke Harris. I mentioned before that I had a chance to meet with her and sit down and talk with her for an hour. I think we have some pictures that we can show you of my meeting with her. And there we go. She gave me her book. On the left of the screen is at her clinic in Bayview Hunters Point. The middle picture is when she came to our Fox News studios in Los Angeles. And the guy on the right, that's Dr. Vincent Felitti from Kaiser Permanente in San Diego. He and another gentleman, Dr. Robert Anda from the CDC, partnered together and formed the original ACES Aware study that Dr. Burke Harris discovered through her research. And that's what we're all talking about today. So ladies, were you aware of this questionnaire and this study before Dr. Nadine Burke Harris brought it to the forefront? And Jen, let me start with you.
Sure. Well, I was somewhat aware of the ACES study, Felitti and Anda did, but certainly Nadine brought it and amplified it, and it heavily influenced our work at Trauma Transformed to really lift up that if we are going to recognize the connection between exposure to toxic stress in childhood and really have a chance at optimizing care and resources around that, then we also have to understand and look at toxic stress in our systems, our medical systems of care and cultures of care, and also address those structural factors as well. Mm-hmm. And I also just want to say I've had lovely conversations with Dr. Burke Harris also around the enhancing the well-being of our medical providers mm-hmm. to be able to care and resource children and families so impacted by early adversities.
Mm-hmm. Yeah, definitely so important. Thank you. And Danielle, I want to ask you, in your opinion, how has the racial justice movement influenced or helped to prop up the ACES Aware questionnaire in various challenged communities throughout our state?
Well, the racial justice movement, it ebbs and flows over the years. Mm-hmm. And what I've noticed in the past year, there had really been more of a silence around how the contribution of racism, both the experience of racism and also the way in which racism increases communities' exposure to adverse childhood experiences. But in the past year, it's almost as if the social sciences started talking to the clinical field more, and this conversation it's helped to generate this conversation. And recently, there was a webinar on that you can find on acesaware.org that actually addressed some of this research that shows how racism itself can operate as a form of toxic stress.
Oh, sure.
I really think that the racial justice movement helped elevate the need for that conversation.
Mm-hmm. Very important. So at least maybe there was something good to come out of that. The subject has come to the forefront and people are taking that more seriously now. Stacy, let me ask you, what does it mean to develop a trauma-informed approach, and why does that matter exactly?
Thanks, Anita. So it's important to establish that being trauma-informed is nothing actually new. For years, creating equitable service systems has been the focus of communities victimized by violence and trauma. But really, the pathway to achieving healing for those harmed by individual, intergenerational, and historical trauma often involves use of culturally responsive practices that ensure interventions are delivered in a manner that really resonates with the values of communities being served and are made available to ensure equity of access. So healthcare providers need to be trained in trauma-informed practices as part of their practice improvement to better establish trust, sensitivity, respect, and really address their own implicit bias to better serve their patients. But perhaps more importantly, we need to remember that being truly trauma-informed requires putting patients at the center. So let's think about it. When someone is experiencing a traumatic event or occurrence, they are not at their most capable to navigate complex systems and services.
Right.
When we experience trauma, our neurobiological functions take over and run the show. And we've all heard of this as fight, flight, or freeze. And we're familiar with that. But in these states, our brain actually shifts into protector mode. And we're stuck functioning with limited capabilities because our brain is focused solely on staying safe. And the other part of our brain that thinks logically is kind of out to lunch and shut down. So toxic stress, which the ACES Aware Initiative addresses, is a repeated exposure to adversity and leads to changes in neurodevelopment, like you mentioned, changes to your biology, right? And in the development of the immune system and the development of our hormonal systems, and even the way that DNA is read and transcribed. So all of these underlying biological mechanisms together create this dysregulated stress response with neuroendocrine immune and genetic regulatory disruption. And it's what we now call the toxic stress response. And then this also leads to behavioral and or physical health problems. So imagine being in this state of dysregulation and having to navigate resources and services. It's just too much.
Yeah.
So trauma-informed approaches help to ensure that patients are met with access to services, ideally through patient navigators, and are engaged with safety and respect to really encourage their healing.
Yeah, there's a lot to think about there for sure. And that's, a multi-pronged approach. I'd like to bring back Cornelle Jenkins into our discussion if we can. Hi again, Cornelle. And I just want to mention that you're from the California Alliance Catalyst Center. So we're talking about, the importance of recognizing trauma and introducing the ACES questionnaire. And I don't know who's best to answer this question, but what are some of the burdens of bringing that questionnaire into a doctor's office? I mean, it seems like an easy enough thing to do. You just, hand the patient this questionnaire along with all the other paperwork they or their parent have to fill out. So why is it such a challenge? And who feels best to answer that question?
I can go ahead and
Okay.
jump in, and I'm pretty sure other people can have their input too. But it does sound simple, but it really isn't that simple. In order to have people willing and able to really talk about some of the adversities, some of the sensitive topics, things that bring up, past traumas, in order to really instill that trust in them to have them speak to you about those things, it's important that you create a trauma-informed environment for them to actually feel comfortable having those conversations. So just giving someone a questionnaire and asking, hey, have you ever been abused? You're not most likely to get the actual responses that you want to get. I don't know my doctor personally, so that seems like a very personal question. But if you train doctors to create this trauma-informed environment, a safe space, and to create a warm environment where kids and their families feel comfortable, then you're likely to get the responses that you're trying to get. And so it's important to create that and foster that environment, not just, hey, answer this question now.
Yeah, no, that's a great point. And Jen, how do you do that? How are you advising people to make people, create comfortable environments so that patients can be honest? Because that's what this is all about, getting the patients to be honest so that they can be treated.
Yeah, I mean, I also think it's incumbent upon us to kind of righteously acknowledge that many people, for very valid reasons, don't find our healthcare systems particularly trustworthy. And to be able to acknowledge and name that, and for our systems to be honest about our generational traumas that we may have induced on communities who are in complicated vulnerabilities and seeking care at this point. So to kind of be honest about our own traumas and that are structural in the medical system, behavioral health systems, in our cultures, and then also be able to role model naming and acknowledging some of our own harms as we also uplift stories of healing in our systems. And I'll just say, personal example, local San Jose, born and raised child myself and family member, and had a lot of ACEs growing up and a lot of exposure to ACEs, and was in contact with the juvenile justice system and the child welfare system. And what I will say is that as a white child, I think my experience was I was less problematized, more given the benefit of the doubt, more given the benefit of resources versus policing, more given the benefit of folks seeing the potential in me versus seeing the criminality in me. And so more access to resources and less burdened by narratives that problematize rather than enhance my healing. So I just want to say that. So I think that there's a lot of opportunity for us. I know that at Trauma Transform, we're going to be doing some supplemental trainings for the physicians around attending to bias in medical care and screening and in treatment of toxic stress. And also as a way of enhancing our own healing as providers in these systems. And many providers have also been impacted by ACEs growing up. And so beginning to see this more as collective healing instead of patient-provider relationships.
Yeah, I mean, if you look at the list, probably all of us have had at least one of these, right? Some of these are very, normal and widespread things. Divorce or parental separation is one. A lot of kids have been through that. Emotional neglect, mental illness in the family. I mean, these are common things that so many people experience. And again, the more ACEs you have, the more likely you are to have a health impact later in life. Danielle, let me bring you back in. How is your organization, ACES Connection, how are you able to work with the ACES questionnaire within the community?
So the founder of ACES Connection since 2012 has established ACES Connection as a social network to bring together individuals and organizations that want to educate the community about ACEs and also develop strategies as a community and often working as collaboratives to build more resilience in their communities. So the way that ACES Connection supports those efforts is to help provide resources and information on our platform, as well as introduce newly established initiatives to best practices in the field, and also find a way to bring the different initiatives together so that they can learn from each other. Mm-hmm. So often, one of the main ways that many of these community initiatives get started is to educate their local community about the ACES questionnaire and that research, what it means, and the fact that once you become aware of your ACEs, that's not the end of the story. That's just the beginning of a better understanding how addressing your ACEs can improve your life on an emotional and physical, in terms of your emotional and physical health.
Mm-hmm, definitely. And one of the things that Dr. Nadine Burke talks about is with the right loving support and treatment, that you can make changes, leaps and bounds, including doctors noticing changes in your brain imaging on the MRI scan. So it's really miraculous. I want to bring back in Chrstine Stoner-Mertz back into the conversation. I think we have her now. Hi, Chris.
Hi, Anita.
Hi, welcome back. I didn't get to ask you before. I wanted to ask you what initiatives the California Alliance Catalyst Center is working on to promote ACEs awareness.
Well, I think we've talked a little bit about, our grants with the Surgeon General. I would love to just take a minute to both thank the panel and also talk a little bit about more broadly what's happening in California, because it's not just about what we're doing. I mean, we have a Secretary of Health and Human Services who's a pediatrician. As you know, Dr. Burke is a pediatrician. The governor is committed to doing better for children, youth, and families. And you're really seeing, and then along with leaders and legislators like Senator Portantino and Senator Ramos, all of these leaders are really coming together and saying, we must solve this problem. We must address the toxic stress, the racial disproportionality that Jen talked about. And they're looking to find ways through a children's behavioral health initiative to really make sure we're addressing these children and youth's needs. So we're thrilled to see it. We really want to make sure that as we're moving forward, all of us together on these initiatives, that we're also looking at our workforce, right? We have a lot of work to do there, both in terms of supporting them, ensuring that we're building a workforce that is truly diverse and represents all of the Californians that need to have ACEs addressed, and that we're really bringing we're bringing together schools, healthcare providers, everyone focused on ACEs. Mm-hmm. So we're excited to be part of both this initiative and also looking forward to where things are going in California. It's very exciting.
Well, that's wonderful that everybody's on board like that. I wanted to take a moment. I think we have some questions from our audience. Someone is asking about the tools to do the screening. If your doctor doesn't have the questionnaire, if you know someone who needs to take the questionnaire, how can somebody find out more about ACEs, getting the questionnaire and learning how to take in the questions and answer them? Stacy, can you chime in on that?
Sure thing, Anita.
Okay.
So you can visit the ACEs Aware website at acesaware.org. And there are different versions of the screening tool available there for various different ages. And they're also available in 17 different languages, which is quite extraordinary. So you can customize for your community needs. But pediatricians should ideally be the ones to screen for ACEs. But if a pediatrician does not offer the screening tool, parents can review the screening tool online and then use that to initiate a conversation with their child's pediatrician.
Okay, wonderful. So that's good advice there. And we showed a graphic before. We talked about the basic 10 questions that are involved in the ACEs questionnaire. But are there other? Here they are again. You can see them on the screen. But panel, I'm asking all of you, anyone chime in. Are there other things that we should look out for? We talked about racial injustice. That's something as well. Are there other things that could be categorized as toxic stress?
I'll go ahead and jump in.
Cornelle, go ahead.
Definitely. So those 10 categories, those 10 items that are listed were the original ACEs that were part of the study done back in 1997. However, we know for a fact that not only does domestic violence in general have an impact on toxic stress and the trauma that children face. There are a litany of other things like discrimination, like poverty, like racism, like just violence in your neighborhood, things that haven't necessarily weren't studied as part of that original study, but definitely cause toxic stress and can lead to some health issues if unchecked.
Yeah, I mean, poverty, right? That's got to be a big one right there. When people suffer from poverty, that's got to have a negative effect that really, seeps into you and really goes into your subconscious. We're sort of running out of time, but what I'd like to do is go around the panel and get a final thought from each of you, a thought about this topic, and maybe just a quick piece of advice for anyone listening. Jen, let's start with you.
Sure. Just final thought that, ACEs happen in a context, and so does the screening, prevention, and treatment of toxic stress. And I guess just one final thought is not to forget about the buffering forces that can mitigate the early adversity and toxic stress effects of ACEs, that we often look at, the stressors or the traumas, and that just to remember that our kids and families and residents also have a lot of buffering supports. Strong relational ties, and there's so much that we can do to enhance those connections and ties in the community, faith-based, sports, recreation, arts, to really strengthen not only our healthcare provider network, but all of our all the folks that support children and families to thrive.
Yeah, really good points. Thank you so much, Jen. Danielle, let me hear some final thoughts from you.
I would just encourage and anyone who finds this topic interesting to get involved locally. There are a lot of opportunities, and there's still so many people who haven't heard about ACEs and don't understand the impact. And what I find, much like Dr. Vincent Folletti reported early on in his research, that when people just learn about ACEs and the fact that something can be done about it, it gives people a lot more hope for the difficulties that they're experiencing.
Yeah, great point. Thank you, Danielle. Stacy, final thoughts?
Similar to what Danielle just mentioned, ACEs are not destiny. This doesn't have to write your physical and mental health future. So I just encourage everyone to know that you're not alone in this, and that there are health and community providers all around you just waiting to be connected to you and your family. So begin by talking with your primary care physician or child's pediatrician.
Yep, that's the best place to start. You're right. Cornelle, quick final thought from you.
Yes, kind of echoing what everyone else said as well, but also I implore you, if you're listening, check out numberstory.org. It's part of the national initiative around ACEs, and it really provides public education. A lot of things we've been talking about have been educating providers and talking about toxic stress and the effect that it has. But on numberstory.org, you can learn about ACEs from a lay person perspective. And you can also learn about the resources and the things that are out there to help combat ACEs. You may have ACEs, you may have toxic stress, but that's not the end of your story. Start at numberstory.org, and we can keep moving forward.
That's right. Not the end of the story. And Chris, I want to go to you for your final thoughts, and a big thank you to the California Alliance and Catalyst Center for all the great work that you're doing.
And I just want to give a shout out again to HealthNet and careprovider.org, who really helped make this happen. We look forward to more discussion and continuing this initiative along with the other initiatives that are happening in California that are really focused on children and families. Thanks so much.
Yeah, thank you. Thank you, Chris, and thank you, panel. Thank you for sticking with us through this whole hour, and thank you to our audience who have been watching. Such an important topic, ACEs, adverse childhood experiences. These are things that happen to so many of us. Numbers.org is a great, numberstory.org, a great website for you to take a look at. If you want more information, also ask your doctor, ask your pediatrician. Ask for that questionnaire. It's so important for your mental health and your physical health. Thank you so much again for joining us, and we'll see you on the next Live at 5.